Good morning, everyone. Welcome to the Board of Commissioners meeting for June 22nd, 2022. A lot of twos in there today. If you'll please rise first for the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
And our inspirational word for the day comes from Matthew. Jesus said, "God blesses those who work for peace, for they will be called the children of God." Madam Clerk, if you call the roll.
Commissioner Lundy,
Here.
Commissioner Moore,
Here.
and Commissioner Hung is excused absence.
Excused absence, correct. We have, I think we're just going to roll right into the presentations, if that's okay. I think
If
most
it-
folks are here.
You want to do that?
Sure.
That's fine.
Yeah,
Okay.
I think pretty much everybody's here. So, Madam Clerk, our first presentation.
All right, well, we'll start with the Mars Board, Michael Dowd, Executive Director, regarding the .60 mills renewal levy for 5 years.
Good morning, Director.
Good morning, Commissioners. Thank you for the opportunity to present today. In front of you, you should have a packet of information related to the presentation today. So certainly if there's any questions after today, please don't hesitate to reach out. So the request is for the .60 mil mental health levy, which expires December of this year. And the estimated tax revenue is $3.9 million, which represents about 21% of our annual revenue. June 28th, I will request my Board of Directors to adopt a resolution to request the Lorain County Board of Commissioners to place before the residents a renewal of the .60 mil levy. So this funding allows us to work with our provider network with a common goal to improve the health and well-being of the citizens of this community through services such as prevention and wellness, outreach and engagement activities, crisis services, care coordination, and residential services, in addition to inpatient services for the indigent population and medically managed alcohol and drug treatment services. Recovery supports to include recovery housing, employment, harm reduction initiatives, Warm Line and Navigator Line, and our ability to collaborate with specialized dockets in Lorain County. An example of some of the services provided is our ability to provide training and consultation with CEUs to the provider network, pool agency funding for bilingual staff, incentives, internships, and interpretation services. It has allowed us to provide capital and operating support to this community's first permanent supported housing project in the city of Elyria, and that is Bridgepoint Commons. It will allow us to provide capital and operating support to a similar project that is planned in the city of Lorain. It allows us to provide funding both to Mercy Hospital and Firelands Hospital for psychiatric care for the indigent population, youth inpatient bed days as well, respite at the Blessing House, funding for the Lorain County Sheriff Jail Reentry Initiative. And last but not least, FCFC, Family Children First Council, funding for operating support. So what do we know? Non-fatal overdoses in Lorain County peaked last year, 463, and we are on track to exceed that for 2022. We send out roughly about 700 adults outside of this county for detox services. We are seeing an increase in suicide rates among the minority population, in particular African American males, young adults. We saw a peak in adult crisis services at the onset of COVID. We saw a peak of child and adolescent crisis services at the onset of COVID. And where do we go from here? We need to move more toward a data-driven outcome system, the enhancement of child, adolescent, and crisis services through the implementation of the Mobile Response Stabilization Services program operated by Applewood, the enhancement of adult crisis services through the Lorain County Crisis Receiving Center with the ability to provide access to observation beds and detox beds with the goal of those 700 leaving Lorain County to stay in this county for their treatment services. And enhancement of recovery supports and prevention activities. This translates to ongoing work with our provider network to look at working with the schools, enhancing crisis care, the ability to have detox on site, and then the development of housing and recovery support services. Any questions? I have some providers here today.
Sure.
They're able to share a story of their clients who access the funding, the services, and talk about the recovery process.
Okay, who wants to go first? I see a number of folks here. I see Let's Get Real, Road to Hope, Victor Leandri.
Hi, everybody. I'm Jeff Cams. I'm the
Hey, Jeff.
Executive Director of the Road to Hope.
Sure.
So I just kind of wanted to share like a little bit of information based off of like the levy funding that, you know, is utilized to support the services that are used throughout Lorain County. And, you know, last year, yesterday I put together, you know, grabbed our last year outcomes just to give you an idea of what those dollars are being utilized for. And last year we housed 482 people through the Road to Hope and through the Recovery Housing Program in Lorain County. And of those 482, 67% of them were homeless when they came to us. So that's 323 individuals that would have been wandering the streets, you know, had they not had that service available to them. Along with that, 58% of those individuals were dually diagnosed. So they were receiving both substance abuse services and mental health services in Lorain County. Of those 482 individuals that came through, 307 finished successfully through the program, and when they left, went into some kind of permanent housing, some sort of permanent housing. In addition to that, over 90% of those individuals that left successfully were employed upon leaving and going into that permanent housing. So at the point of, you know, being homeless when they came to us, they left in a different, you know, environment, you know, being an asset to the community versus a burden to the community. You know, and then 114 of those individuals that I mentioned are still, you know, currently in the program and being housed with us. And all these individuals are not wandering the streets trying to figure out, like, making decisions based off of circumstances due to the, you know, services that are provided through all the funds that that the Mental Health and Recovery Services Board utilized for social services in the county. Thank you.
Yeah, it was great being out there, seeing the launch of your new facility. It's going to help a lot of families, that's for sure. Don, okay, Dan, and then we'll get to Don.
It's all good. Dan Haight, President and CEO of Lacataway. I'm going to give you a quick success story, kind of give you a snapshot of somebody who comes through our services. Recently had a 35-year-old female who went through our residential treatment program, lost her children, obviously due to her drug addiction. And I can confidently say today she's sober, she's employed, she has sober living in our community. She's working with Children's Services currently to regain custody of her children. And then again, trying to connect with her family through parenting classes and through family sessions. Now, the reason I give you that success story is, as you noticed, Mr. Dowd had mentioned certain things that they fund. Drug addiction treatment is not one of them due to the levy language. So the current levy language will help provide that treatment and success that we hopefully can gain through people who have these things. The residential treatment program at the Licata Way gets funded through Medicaid, mainly through these people that come through us. However, the room and board, when they're there, does not get covered by Medicaid. The family services that they provide do not get covered by Medicaid. So there are services that we go to either grant agencies and or to donations in order to achieve those things. In fact, so far year to date, we have over about $90,000 in uncompensated care for treatment services that we provide, and another $200,000+ in prevention services we provide to the community. So that's to the Boys and Girls Clubs, to New Horizons, to some of the schools, the community in general. So with this levy being added to the language of allowing addiction and treatment services, along with prevention, we'll be able to have that prevention services in the communities further embracing the community that we provide these in. So one of the biggest things that we see, the levy money utilized for is insurance. Somebody has a job, they have medical mutual. Their co-pays are going to be outrageous for substance abuse services. The parity still hasn't been enforced through the federal government, so they have to come up with the first $1,000. They're never going to pay that and be able to succeed with a family and a car and rent and those things. So those are things that prevent them from getting treatment. If we can use some of those levy dollars to provide that first set of dollars, it'll gain access to care for those things. So, thank you.
Thank you, Dan. Don Schiffbauer.
Good afternoon, Commissioners. My name is Don Schiffbauer, and I am the CEO for the Nord Center. And I'm going to expand a little bit on what Mr. Dowd talked about quality. You know, I can sit here and talk about the 36,000 unique services that we've provided, the 1,500 emergency assessments that have been provided. But as the largest recipient of funds from the Mental Health Addiction and Recovery Services Board, the Nord Center is the county seat for mobile crisis response and crisis response in the county. This levy represents an opportunity to continue to fund a service that is not reimbursable by Medicaid, Medicare, or any other type of private insurance. In short, it is essentially a mental health first responder levy when we look at how we use those dollars to operate our services here. Crisis services are essential to be able to provide that upfront support and an alternative to jail and emergency rooms. Our mobile crisis teams are present 24/7 a day. We're also utilizing technology to better utilize monetary resources to expand our outreach into the county by outfitting Oberlin Police Department, 17 squad cars, with iPads so that they can have access to mobile crisis clinicians directly in our hub center. And we're getting ready to expand with Chief Barfield in Wellington. But there's one program that we provide at the Nord Center that is fully funded by the levy dollars, and that's the Warm Line. Now, when you're in a crisis or experiencing an emergency, you're calling the hotline, but you may not need that level of service or that level of intense therapy initially. You may just need an opportunity to pick up the phone and call somebody that has lived experience. And that person, who we'll call Sam today, has been a Nord client for years. Sam calls the Warm Line every day. Sam uses the Warm Line to receive, get coordination with outpatient providers. She gets additional support from peers on the Warm Line. Peers on the Warm Line are people with lived experience. I, as somebody who hasn't been through a mental health or substance use disorder emergency, can't appreciate what somebody's going through in the heat of the moment. And having a peer support specialist, like our colleagues over at Let's Get Real, gives an avenue for these clients to have conversation with somebody with lived experience. By calling the Warm Line on a daily basis, Sam's ability to function successfully in the community has increased. Sam's been calling the Warm Line for well over 2 years. Sam, in the past 2 years, has not accessed emergency crisis services during those 2 years. This is a high-value,
highly cost-effective provision by this levy that is not only accessible by Sam, our example here, but also by thousands of others within our community. Thank you.
Thank you. Kim?
Hi. My name is Kim Eberly, and I'm the Executive Director of a recovery community organization called Let's Get Real. I can stand here and give you about 100 success stories and bore you until you say, someone please have her be quiet, which my colleagues usually do. I'm not going to do that. Here's what I'm going to tell you. Are there major successes being done? Yes. Let's Get Real is like the fingers and the gaps in services for all the providers, some of whom are sitting here, some of whom are not, to provide that initial crisis management. We go to warm handoff in Mercy Regional Lorraine, Mercy Oberlin, Cleveland Clinic Avon, and Any Day UH at Elyria. That's a crisis problem. So speaking on behalf of the crisis upcoming unit that we have dreamt for many, many years to have, what we're forced to do is we're forced to take your Lorraine County residents, my Lorraine County residents, my community, and I'm forced to take them in a crisis situation out of county. I don't have any other choice. We have Silver Maple that provides detox, which is often the first step in that crisis, obviously, if you're being called to an ER. And I have to take them to Fremont. I have to take them to Cuyahoga County. And then I have to try to pull them back in to maintain some sort of continuum of service. Speaking from somebody that's in long-term recovery, somebody that went to treatment, somebody that went to detox 17 years ago, if I can't strike when that iron is hot, you may be sincere in that moment that you really want to be clean and sober. There's a stigma and a stereotype that's always shouted out. They're going to stay clean and sober when they want to. I put it to you, nah. They're going to stay clean and sober when somebody's there in one building or one area or in the car with them from the beginning of that crisis for a month, 2 months, 9 months, whatever it takes afterwards. That's where you'll see these giant successes. So to build this building is great, but to not be afforded the opportunity to show what it really can do with all of us there and other providers in the county. And so you bring someone in and there's an access to, oh, there's 5 treatment centers that you're going to help me talk to. I may not want to go to sober living. I may not want to go to recovery housing. These people have a choice. These people have a right to some sort of buy-in to their recovery. And it can be afforded through levy dollars. It can be afforded through the crisis facility. It can. And we will all work together as a team, all the providers, and that person that's in that crisis will be able to say, wow, I can talk to everyone here, and you're not going to leave me? Then you'll see results. I went to Dollar General the other day. They're closed 12 hours a week because nobody wants to work. These people that you are serving, that we are serving, that my colleagues back here are serving, these are productive members of society. They've just lost their way. And I don't get money, okay? I don't have a lot of money, so I don't get money. But I know that it's our responsibility to serve these people in Lorraine County. I know that it is, and I know that we have the opportunity to do so, and I know we have the opportunity to set a pilot example, as we have in the past, to other counties in the state, and say, oh my gosh, they're actually doing this, and look how they're all working together, and look at all the continuum service they have, and I just think it will be a beautiful thing. I can shout numbers at you. I have them here, and I'm not going to do that. To how many people that I had to take out for detox, bring them back for recovery housing, bring them back to whatever. It negates the flow. It negates their buy-in to their recovery. Every little pebble that happens in early recovery is a mountain to you. But it doesn't mean you don't want it. It doesn't mean you're not worth it. And it doesn't mean you don't deserve it. Thank you.
Thank you, Kim. Victor? I was going to say, I think I got my batting order wrong. I was going to call you the cleanup guy, but I think you're fifth. So.
Oh, sorry. So, good morning, commissioners. I came to support the network, the mental health network, not with the plan to address or talk to you guys in regards to the network, but I feel the need to do it for several reasons. First, my background is mental health, and when I came from Puerto Rico, that was my first job here in Lorain County, working at the Nurse Center, a place that I love, and I thought I was going to retire from there. But El Centro also provides services as part of this network. We have the money management that is representative pay for over 300 individuals with severe mental illness, that we're the one that control their Social Security. And through a pandemic, we were working and delivering money to their houses and everything. So it's one of those services that we are recognizing in Ohio for the quality services that we provide. But my passion for mental health has been so big that I still very connected with mental health. I sit in the largest mental health and addiction civil advocacy group in Ohio. It's called MAC. So I'm part of that state board. But I'm also the chair of the Mental Health and Addiction Coalition for Northeast Ohio. Also, so I still very connected with mental health. And what brings me proud is that every time people talk at a state level or a regional, every time people talk about Lorain mental health services and addiction, they're always using us as an example because of the quality of services that we provide, and always looking for us as a role model. And when I sit in those boards, it always bring me pride because we know we have a quality services in this county that I hope this money and this levy will help to continue or even improve what we have right now. But I want to talk about specific one services that we have that we provide at El Centro. 6 years ago, the Lorain County Board of Mental Health contacted El Centro to start a mental health and addiction navigator line. This is a line that is not to replace the crisis line. This is a line to help every average resident in Lorain County, Latino, no Latino, English or Spanish, anyone that needs mental health services that doesn't know how to start and how to get connected to mental health services, call the Mental Health Navigator line. And from there, a social worker connect them to the best agency for that individual, taking all the barriers away from it. If that person doesn't have transportation, they look at what is the closest mental health agency. If that person needs interpretation because it's a Latino, that mental health navigator line put out interpreters or connected with interpreters. That person doesn't have insurance, they look for what agency is the one that is going to take them. So that person is the one that take all the barriers and connect that person. Back on 2019, the Mental Health Board came and spent a day at our Centro shadowing the Mental Health Navigator line, and they left so impressed that right now they're trying to duplicate a line that we have in Lorain County in Columbus, Johnstown, Toledo, Akron, Cincinnati. There's 7 in Antigua, in one canton. So it's takes so pride that something that we have in Lorain County now that as state organizations try to duplicate in other big cities, it is so pride for us because we connect people with the mental health services. That line, on an average, help over 120 people every single month connecting with mental health services. So, and also another services that this levy will help is the interpretation, knowing that Lorain County have the biggest per capita, the biggest Latino community in the biggest city. This money is using to help Latinos to get interpreters, but not only Latinos. These are the fundings that is helping even the Ukraine families that we're welcoming here in Lorain County now, so to get interpretation for mental health services. So that's my spiel for today, and I hope that we all support mental health and addiction services in this county. Thank you.
Thank you, Victor. Anyone else? Michael, any closing comments? No? Any questions, Commissioner? You're good?
No.
Okay. Yeah, I just want to thank all of you for being here today. We're not making a final determination today on placing this on the ballot. That'll come either next week or the following week. But we thought it was important for the community to have to be educated, have an orientation about this. Obviously, our county has some designations we're not very proud of. Those are federal designations for high-intensity drug activity that take place in this county, which means that the activity is very active. At the same time, you can hardly talk to somebody at your church or at a community event that doesn't have a family member that's been impacted. And if your family hasn't been impacted, you are really among the lucky ones. And as I say all the time, very good people become very addicted. And, you know, the important thing to remember here is it's a disease. It's not a choice. And some people's brains light up when they take a certain pain medication or drink alcohol, whatever the case may be. And for other people, their brain doesn't light up. And that's the difference. So we have to look at this as a disease. This isn't something where if an individual simply stops going out on a Friday night with some friends, they'll be a better person. The other important part here is that we have to de-escalate the situation as quickly as possible. We have to get people in front of professionals when they're ready to make that transition and improve their lives and turn their lives around. But this is a lifelong process. I mean, every morning that I wake up, I'm not worried about if I have a drink or take a pain medicine that day prescribed by the doctor, but there are a lot of people who do, and they know that they can't go down that road, and they look in the mirror every day realizing they start because they have a disease. It's addiction, and they have to, you know, live their life in a different way every single day. So the other important part here is the existence of, if you have an addiction problem, you, in most cases, have a mental health problem. If you have a mental health problem, there's a good likelihood that there's some addiction taking place. So the two do come together, and we need to address them in that way. So I think this is a very important issue coming before the voters. You know, obviously I know we're in inflationary times and not happy with some of the prices that are being paid these days, but the reality is that in the long run, our economy here will be better if we have healthy people who are able to go to work and support their families. I can tell you from a county perspective, you know, you don't have as many cases you'll have to prosecute, people you have to arrest, people you got to put in your jail, if we can just help people turn their lives around. And by the way, our county is currently the biggest, our jail is the biggest detox center in the county right now. That's not something we want to be doing, and it has to be addressed. So I would just ask the public to understand that the best way to help our families, keep our loved ones alive, help our economy, and if you don't like paying for social services, the best way to reduce the cost of social services is making sure people are healthy, out there earning a living, and living a productive and positive life. So thank you for your presentations this morning. Thank you for all that you do. I know it's a daily challenge, and it's a hard lift every day. You see the firsthand stories and the struggles, and you should be commended for each day, you know, getting up and going right back in and engaging these folks, because somebody's got to be there to help them.
Well, Lorain County's got some of the greatest people here. Like Victor said, you know, it seems that Lorain County seems to lead all the time the whole state of Ohio. It's like your programs. I see that day in, day out. I think the biggest asset this county has is people like all of you. And thank you for all what you do. Like the Nord Center, it's recognized nationally, and it's here in Lorain County. I was fortunate enough to know the Nord brothers, and huge supporter of the Nord Center. So that is great news to hear, because that happens a lot with Lorain County. You know, we have the greatest people in the world here working to help others. One of my concerns, and I don't know, maybe who's going to be leading the charge on the marketing aspect of this? Have you guys discussed this as a group or as a board? Is the Mars board going to lead the marketing and education? Because that's going to be key. It's going to be a tough election coming up in November. Have you guys discussed that and earmarked money for any of this, or are you allowed to?
We're pulling together
Michael, if you come up to the podium.
Because we only have about 200 people that watch this, okay? I know it seems, you know, so I'm just saying.
We're pulling together a Friends of the Mars board.
Okay.
Hopefully sometime next month, we're going to convene a small group, those who are community stakeholders, to talk about next steps. We are in the process of developing a communication plan as well. We do have some dollars set aside for marketing, printing materials, and then going out into community to tell the story.
Okay, because we're like 4 months out.
Right, right.
I have to remind Matt all the time.
Yeah, I was at several community events over the weekend, and the Mars always seems to have a booth or a table and out there in the community talking to people, and that's a good thing to see.
Yeah.
We're trying to get out there more and more.
No, I appreciate it. Just unfortunately, people don't watch these meetings, so you guys did a good job today. It's just, we're gonna have to get that message out to about, I don't know, what are they looking at, 90 to 120,000 voters coming up? So,
Yeah,
okay.
thank you.
Well, thanks for answering that.
Thank you.
Well, thanks for everybody coming in.
Yeah, and if you folks need to get back to the office, don't feel like you're offending us if you leave.
Yeah,
Don't
people
worry
do it all the
about that.
time because you're not on camera now, so you can sneak out.
Exactly, so,
Yeah, see, they're all going.
yeah, there they go. Okay, head for the doors. Exactly.
We have two
So
people
long.
left.
Oh, no, we got others.
No.
Thank you. Madam Clerk, up next.
And next is the Major Don Barker, Sheriff DTF, on the .08 mils for the criminal justice renewal levy, 5 years, and also Kavanaugh is here with them.
Hello, good morning.
Good morning.
My name is Don Barker. I'm a major with the Lorain County Sheriff's Office, and I'm also the commander of the Drug Task Force. With me is Commander Kavanaugh. He's the commander of the Lorain County SWAT team. What we're here for is ask for support for the renewal of the .08 mil criminal justice levy. The levy is earmarked for support of Lorain County Drug Task Force. A little history, in 1982, a permanent levy was created for the MEG at that time unit that still exists today. And that continues on, and it helps fund the Lorain County Drug Task Force and the Lorain County Crime Lab. Currently, the Lorain County Drug Task Force received about $419,000 from that levy. In 2013, the Criminal Justice Services levy was created. And it was a 0.08 levy, and it costs approximately $2.50 per $100,000 property value. That levy has been in place since 2013. It's been renewed a couple times, and we're asking for a renewal now. It's calculated to produce about $556,000. Total, our overall budget for the Lorain County Drug Task Force is just over $1 million. So we're right at that cusp. One of the things we have done for the last 30 years is apply for grants. Every grant we see that we are eligible for, we apply for. And we've been successful, and we've had some major successes. In 2013, there were 26 task forces throughout the state of Ohio. Currently today, there's 43 task forces, all vying for the same dollars, which are dwindling. One of our major grants that we apply for is the Ohio Drug Law Enforcement Fund. It's funded through a addition to traffic citations, a $3.50 addition to traffic citations. Back when it was created in 2009, it brought in $5 million that was divided amongst 26 task forces. Today, it's generating about $2.3 million that's divided amongst 46 drug task forces. So our dollars are significantly dwindling. The results of that is this year we applied for that grant in the sum of $333,000. It wasn't an extravagant request, it's just basically salary request. We were awarded $97,000 with a cash match of $32,000. So it's listed as an award of $130,000. The reality is it's $97,000, $32,000 comes out of the drug task force. We move on, we apply for the Edward Byrne Memorial Justice Grant. And that was formed, it's a federal grant to support drug task forces. It also is dealing with more drug task forces. And as an example, this year we applied for that grant in the sum of $105,000. And we were awarded $65,000. So that's down $40,000, but again, we keep moving on. Now, one of the things we realized over time is, as we've just heard, about the addictions, recovery and addiction services. We've been dealing with the fentanyl addictions, overdoses for several years now. And what we're finding, and it's through intel sources, through ONIC, which is Ohio Narcotics Investigative Center, through HIDA, and through those centers, we're finding fentanyl in almost every compound of drugs that we're seizing. It's in everything. And we're seeing those same results in all the toxicology reports. So far this year, we've had 52 overdose deaths. The ages are broken down in the following groups. 15 to 24, there's been 5. 25 to 34, there was 9. 35 to 44, there was 12. 45 to 54, there's 11. 55 to 64, there was 12. And 65 plus, there's 3. So it's the wide gamut. It's the whole, when we write a grant, we put in our target population. Well, we're basically saying our target population is population of Lorain County. As you see, that's the numbers I just gave you. And the geography of that covers the whole area from Wellington up to Avon to the whole gambit of the county. One of the biggest issues we're seeing with fentanyl is pressed pills. Pressed pills in the form of Xanax and Percocets. People think that they might be buying a Xanax on the street or whatever from a friend, and when in reality they're buying a fentanyl pill. And what we're seeing is a lot of overdoses from those. You know, we see numbers, we have statistical numbers that are different than a lot of numbers because we get hospital, EMS runs, hospital calls, and a bunch of other calls. When we're dealing with about 950 overdoses for the county, that's not just deaths, that's overdoses. Now that could be accidental, purposeful, and all those things. They're all included in that number. So with that, one of the things we realize is we're basically, if we're not dealing also with recovery, we're just the proverbial dog chasing its tail. So through the state of Ohio, they've offered grants that we have applied for and we have been awarded. There's first the Ohio Recovery Grant. That helps us with programs for anti-drug presentations, programs for information, education, and also helps with our QRT. QRT is a quick response team. Quick response is within 72 hours, they try to get law enforcement and somebody from Licata or Mars to go out and respond to an overdose victim, a survivor, and their family, and speak to them about recovery. Give them some information, brochures. Sometimes it's an effect, sometimes it's not. But with coronavirus, we've got cut down on how much visits we could do and also on the opportunity to do our presentations. So one of the things I did this year was presented a programmatic change for the Recovery Board, which they, Recovery Grant Board, which they approved. And it's going to allow us to buy basically an $80,000 piece of equipment to help with a presumptive analysis of compound mixtures. Currently, right now, most of seized drugs do not get field tested, only because fentanyl is so dangerous. You can contaminate individuals, you can contaminate your agency. This device we're looking for, BCI uses, you can take a swab of the exterior of the package, and it's enough of a sample that it'll give you the test of what's included. The good thing with that is it'll also test for explosive materials, so we can utilize it with our bomb squad as well. From that grant, we also applied for another grant that came out last year in 2021, was the Ohio Comprehensive Opioid Stimulant and Substance Abuse Grant called COSAP. With that grant, we were awarded $291,721. It's for 2.5 years. It's allowed us to hire 2 investigators to go out and do these QRTs, to do follow-up for recovery, and to do the presentations and work more closely with Mars, Licata. I've got calls into these guys for meetings, and it was kind of nice to see some people. So we can come together and build together. We you know, across the state you see some law enforcement-led recovery. And Fairfield County is a great example, if you look down there what those guys are doing. And that's what I'm trying to envision for us. That's what Dan Haight and I have spoken about, is just getting it together. How do we marry these things together to make them work more cohesively? One of the things we see is in recovery is getting to the addicts, getting to people that have these issues, and getting them into resources. Trust me, I understand addiction. You know, when you look at me, a bag of potato chips and me are the best friends. So it's like I understand that. It's not the same issues. Mine are visible, and there's so often that there's addictions that we're not even aware of. But so those are parts of what we're working on. And one of the other things we do as the Drug Task Force is we do law enforcement. And we work closely with the DEA, HSI, FBI, and the Postal Service, and all of our local partners. Recently, we did a case that started off as a drug case. We knew he just pled guilty to a case. We knew we had him suspected for dealing. We did an investigation with Elyria. It was too large just for one agency for the amount of surveillance that was going to be required and stuff. And that turned into a human trafficking case. He's pled guilty to the drug charges. The human trafficking side's pending, but we got a 54-count indictment, which is still noted by the State Attorney General's office. It's a pretty phenomenal thing. But these are things that develop in these investigations. Also, in the last year and a half, I've been personally involved in a couple investigations that were directly related to Mexican cartels in Lorain County. They come specifically to Lorain County. As we heard, our Hispanic population is significant, and you can function without having to speak English, which is good for a cartel. In those investigations, in one of the investigations, we seized 24 kilos of cocaine and several $100,000. And in another investigation, we seized $114,000. And those kind of things we don't get to brag about a whole lot, because those continue on. They continue in different areas. You know, sources, you get information, and you can't really talk about it. You know, the Lorain County Drug Task Force also supports the SWAT team. We have supported through the personnel assignments and through financial support. The SWAT team is responsible for numerous calls throughout Lorain County, and also supports Elyria and Lorain with their SWAT teams. You know, we're prepared to continue into the future, and it's just through like the levy funds that we require in order to continue on. And I think that's all I have. You got it?
No, I think Don covered it pretty well. I was
You can go to the microphone, please.
Oh, sorry.
Major. Thank
I
you.
was a past commander for 30 years. Excuse me, and a lot of these programs and stuff we're talking about, Don's covered it very well. I know when we went ahead and decided we needed more funding because all the federal grants were kind of dwindling away, and so were the state. That's continuing today. This is the third time for this renewal grant, and it's very important for our survival. Okay, without that money, with the dwindling funding from the feds and the grants, it's going to be hard to survive, and we just basically break even. They're not asking for additional funding; it's just to stay the same. Okay, and we can function with what we're doing, and we've been pretty good stewards of the funding over the years, and we're going to continue to do so. And when this was first put together, the SWAT team was put back in 1990 was our first grant with OCGS funding, and we developed the SWAT team, and it's been functioning with us ever since. Okay, majority of that funding has been there, but we used to function a lot with our forfeitures and that. We don't get the same forfeitures like we've done in the past. The system has changed. Okay, so some of the agencies that are on that SWAT team now also put some money in to help support that team. That's just because the money has dwindled so much. So trying to get the renewal for this is vitally important for our operation and to sustain future ops for the future. And there's a lot of cases that go on here that can't be discussed just because they're continuing. They're going in other areas, international and everything else, and it's been like that and continues. So, and Don, those guys are doing a great job out there doing that stuff. That's all I have.
Thank you.
Sure.
Thanks, gentlemen. Any questions?
The equipment you're looking to purchase, is that going to be run through the crime lab or through, you guys have a division that's going to operate some of this stuff? Or
With the presumptive the analyzer, and it's like an MX 908 or something like that's its numbers. That actually is gonna be housed at the Drug Task Force, and we can take it out to different agencies, we can transport it out.
So it's portable and.
It's portable to
Oh,
use, yeah, and it'd be the same thing with the bomb squad if there was a call and need for it. And we kind of, we always look for the way to commingle things as much as we can, so.
Well, we just want to thank you for the job that you do. A big part of that is shutting down the supply, right? And I know that you're working closely with, the feds and everyone else to try to get people off the streets and so that these drugs don't reach our loved ones and kill our loved ones as it's currently happening. But I know it requires a lot of work, and you walk into court or you run to the prosecutor's office, he wants to make sure you get done all your paperwork and you got the strong evidence that you're bringing in so they can prosecute the cases, because prosecutor's office, I'm sure, gets plenty of calls, people demanding to know who killed their loved ones.
Oh, absolutely.
So there's a lot of work that's done behind the scenes, but I know this plays a very critical role in the community, and it's a daily challenge.
I'm
So-
glad you touched on it, because it seems to be a national issue right now, which is counterfeit drugs laced with fentanyl.
Right.
I'm glad
Yes.
you touched on that. I've been reading up a lot about that.
Yeah.
I mean, people don't realize this is hitting everywhere, just because people think maybe a Xanax, hey, no big deal, but it's
Right.
being laced, it's being counterfeited, it's being imported through the borders in Mexico.
Right.
It's a serious issue.
Absolutely.
And I don't know how you guys are gonna fight it. I really don't. It's such a huge issue right now.
It is, it's one of those things where if you don't resist it, you'll have it everywhere.
Yeah.
So it's you park one patrol car and you can slow down speed for several miles. So it's just that kind of thing.
I sent an email to JR this morning in regards to the breakdown. I think you guys probably heard my comments in regards to the crime lab. I talked to one of your officers last Thursday at the Lorraine County Township Association. I'm sure, do you guys got word of that or no? Did you hear?
Was that Captain Bosley?
Yeah.
Yeah.
Okay, so, he talked about the 1982 MEG, which I didn't know these were the breakdowns, so it's 419. So that's not not the .08 mil we're talking about then. It's not the 900,000. This is basically the .08 mil is gonna be for, 556,000, I take.
Correct, that's an additional, that's
But it
the,
has nothing to do with the MEG, that's
No,
a
that's separate.
permanent, right?
correct.
Okay. So out of that, so how do you guys fund how do you guys use the crime lab then? Because they get about $200,000. So how do
They-
you break that down?
The numbers I gave you here
Yeah.
is what we received, the 419,000 is what we received. So I'm assuming when the funds come into the county, the crime lab gets their portion from the get-go. I think when this was established, it was broken down to a third for the crime lab, 2/3 for the drug task force.
The MEG?
MEG, yeah, when the MEG,
was
when the MEG,
1/3,
grant, sorry,
2/3, okay.
correct.
And then how about this one, the .08 then? How, is that broken down at all, or do you guys receive all of
that's-
that?
That's just the drug task force. That's how that was decided when we put that levy on when,
Just
the
okay.
board, right.
That's some of the questions I gave you, so I guess you don't have to worry about it, JR. I'm getting those answered right now. So.
Yeah, I think that's where there's always been some confusion.
Correct.
But
And the MEG one originally, that was dwindling all along. That's where we decided to go with another grant from what it used to bring in, okay? So that's why when we had the meetings with the commissioners, we decided to go in that another direction just to get enough to support our operation, because we knew that was dwindling as well as the federal grants and the state grants.
okay.
You guys foresee any more money coming in because we haven't gotten the numbers from the auditor yet, the county auditor? Do you foresee an increase in funding because of valuations and such, or?
I hope. There is, well, there's a lot of development. When you get out
Right.
in some of the townships, the development, I used to pride myself on knowing all the roads in Lorraine County. I don't. There's roads I have no idea what they are, gotta look them up and all that. So hopefully with the development, because like in Columbia Station,
Oh, yeah.
those are not small homes, so.
Okay, well, we're getting excited to see what the numbers are gonna be from the auditor's office, so.
I sent those to you.
We have,
Was that the,
They didn't know about it either?
was that the 556, the 566?
Yeah, 566.
566
Okay.
is the estimate, yes.
Okay.
okay.
What was it? Remember what it was before?
The original?
Yeah.
Originally, it was 492 is what we had
Okay,
gauged
so
it
it's
for.
gone up.
Okay.
It's kind of about
Yeah, the
70,000.
first year when we had the first 4 years, or 5 years.
Last year, we received 554. So,
Okay. So you guys are looking at, it looks like you take this money, stretch it out and get even more grant money, and it seems like you guys are doing a
Correct.
fantastic job.
and that's one of the things with grants, is they always ask about sustainability.
Right.
How do you sustain the program? So by being able to have funds, we can say we can run the program into the future, as opposed to, no, once the grant's expired. I had the privilege to sit on a grant review board, and one of the big questions that came up at the grant review board was, how are they going to sustain this? And if the agency couldn't sustain after the grants expire, they weren't likely to be funded. So,
Okay. Thanks for coming in.
Thank you, gentlemen. Thanks for all that you do.
thank you.
Okay, Madam Clerk, we have another presentation this morning.
We do. It's Jeff Young, Director of 911 for the .50 mils renewal or .50 mils renewal with a .25 increase for .75 mils for 5 years.
Morning, Director.
Good morning, Commissioners. How's everybody today?
Oh, everything
How was breakfast?
Great.
Pretty good?
Yeah, the International was nice.
That's good. It's time to renew the 911 levy. That's, except for 10%, is pretty much our sole source of funding to operate the 911 center. We get about 10% from the state of Ohio through legislation down there from phone bills and all that, cell phone bills and all that sort of stuff. There's a House bill under consideration down there to increase that funding, but who knows if it's going to pass and at what level it's going to pass. But currently, we're getting 25 cents per phone, and they're looking to increase it to 75% or 75 cents. So that would be potentially good news for us if they do it. You could probably guess better than me if that's going to occur down there. So some of the things that, like I said, that's our sole source of revenue for the 911 center is the levy. In the United States, the way 911 is funded varies from state to state. The wire lines, they go anywhere from 20 cents to $2 a piece. In Ohio, they're 50 cents. So you can see we're on the lower end of that. The wireless runs from 20 cents to $3. Again, we're at 25, so we're at the lower end of that scale. And the voice over IP fees range from $0 to $6 a piece, and we're at 0. So there's a bit of a funding gap nationally for what we're putting up with here in Lorain County. That said, I think we do pretty well with the funds that we do bring in. They're substantial funds. It's a lot of money. There's been a burn rate that I discovered when I started working here that almost made me fall out of my chair. But then I started looking into it, and there's a reason for it. There was funding for this New World CAD system for the police departments that was pretty much paid out of county funds. The enhanced 911 system that we have in Lorain County that's not universal across the state of Ohio was again funded through 911 funds. And the ability to text 911 was also funded that way. So we've spent a lot of money historically to get our technology up to where it needs to be. And I think that's the main reason for the burn rate. I see the burn rate slowing. We just did the New World thing, and I believe that's coming out of rescue funds, so it's not a big impact on the budget. Something else that we've started for the first time, and I've already talked about this, is everybody that's hooked to our CAD is paying a fee for that thing. I believe that we can do this again on a renewal, because this is a scary time asking for money, and it's very understandable. But a lot of good people are here today. There's a lot of really good programs that rely on this funding, And I believe that any organization, everybody's got to be successful. You know, you don't want to pit people against each other. That just doesn't do anybody any good. Everything we do in Lorain County is important. So the way I look at this, it's my charge to operate within the budget you guys give me. It's just that simple. And some of what I'm doing is, getting rid of duplicated services, paying for two different things. It's something I work on every day, trying to reduce the amount of money we're spending. And that number is going down. What I'd like to do is sit down and come up with a business plan going into the future with the money that we have now and making that work. I think that's the best course of action. I believe it's the most responsible course of action. But it's really important that we not lose this funding at 911. It's a lot of money. and I don't think it's funding we want to pick up in the general fund if it were to fail. And if it were to fail and we had to use general fund money, I think there'd be a whole lot less people working there. And that just is not a good combination. Just real quickly, we're the sole answering source for 911 in Lorain County. Every 911 call comes into our dispatch center on Byrne Road. Last year, we brought in over 361,000 calls, which is just short of 1,000 calls a day. It's a very busy place. We dispatch 26 fire and EMS agencies, 7 law enforcement agencies. We provide pre-arrival instructions, services for the hearing impaired, just all kinds of stuff that people just take for granted, but they're necessary for us to get help going to these people that need help. I mean, you have, that interpretive service thing is really important. It's amazing the different languages that come through Lorain County, and we have to have access to that quickly. It's pretty amazing. It's an expensive service, but it's well worth the money, and it's got to be paid for. I believe that if we build an organization over there with the right people on the team, with the right consultants, giving us expert opinions so we're making wise decisions going forward and not wasting money on decisions that weren't so good, that we could be successful. So I believe that a renewal would be the way to go, but ultimately that's not my decision. I pledge to you that no matter what you decide, I'll manage it the best way I can. But it's a busy place, it's a necessary place, but just like everything else we've heard today, it's all pretty important and pretty necessary. So beyond that, I don't have much more to say about it. I think it's pretty clear cut. I got a bunch of papers I can read numbers to you, but I don't think that's a good idea. Does anybody have any questions or anything?
Commissioner?
All I heard was that you want a renewal and not an increase. That's what I just heard. I also heard that you're trying to create a business plan, which I like. Well, I like what I'm hearing, but I would like to have that yesterday. So when do you think you could have something presented to this board, or even to, I would like to look at it as quickly as possible, because as I said earlier, we're 4 months away.
I agree.
And all I heard right now is that you don't think a .75 will work, which will make 911 break even, but you believe that a half mil will pass. That's all I heard. I heard a lot of vague comments. I didn't hear specifics. So not to put you on the spot, but if you could, what kind of time frame do you think you need to organize like what you just said today and kind of sit down with me and go over that?
A week.
A week? Okay, good. Okay. That'd be great if we could set something up next week.
I'd appreciate it, yeah.
Okay, and you're sitting back there by Amy, she'll get you on right away.
Okay. Okay. Yeah, I can get you what I have and, some of the ideas that I have.
Right, that's what I need.
Yeah,
Okay.
yeah.
Because the quicker we can nail this down,
Absolutely.
the better it's going to be for the community.
Yeah, and I know that recently I sat down with the director and your leadership team. We went through pretty much the budget line by line and really drilled down on it along with the county administrator, trying to figure out where the duplicate services were in there, trying to figure out which contracts were expiring on some different services, and what some of those new costs were going to be. And also, there were some costs, I think, that were being picked up by 911 that probably should be picked up by another department or two. And so that would require adjusting their budgets to cover those things. But Commissioner Moore, just to kind of answer your question, I think we started really making substantial progress to where it can work within a renewal, which I think is the goal here to achieve. I think anything outside of renewals will be difficult. And I certainly think in this climate, renewals may face their greatest challenge ever, which is not a good thing, especially when your services are so critical and Mars services are so critical and drug enforcement is so critical. It's all critical. So I hope that voters will understand the immense importance and value of these levies as renewals, and we'll continue to support them. But I felt like we made a lot of good progress in those meetings, and it seemed like some of the budgetary concerns I thought were going to be more in line with making it possible for a renewal.
Again, I want to see numbers.
Sure.
We're at a $2 million deficit, and if this board decides to move forward and go with even a larger system, I'm going to ask you what's it going to cost for those carrying costs. I'm going to ask you what it's going to cost to move forward, and I'm not going to go into details right now, but I think you know what I'm talking about. So we'll talk next week.
No problem.
Thank you.
And I think some of the things we worked on, Commissioner, I think you'll like some of the things that we see. I think you'll be happy.
Okay.
So, or at least
I like to-
happy.
I like to be happy.
A little more happy.
Okay, a little more, it's M-O-O-R-E.
There you go, M-O-R-E, happy. Okay. Ouch.
Don't worry, be happy. Okay.
Okay, very good.
Thanks.
All right, thanks for your time. I'll talk
Thank
to you
you.
soon.
Okay. Madam Clerk, I think we'll roll into.
Start our meeting?
Yeah, we'll get started now with resolutions.
All right, number one, investments.
So move.
Second.
Discussion. Commissioner Lundy.
Aye.
Commissioner Moore.
Aye.
Number two, appropriations.
So move.
Second.
Discussion. Commissioner Lundy.
Aye.
Commissioner Moore.
Aye.
Number three, transfers.
So move.
Second.
Discussion. Commissioner Lundy.
Aye.
Commissioner Moore.
Aye.
Number four, advances, repayments.
Were there?
There are none.
I
I just want
didn't
to
see
make
any.
sure.
Okay.
Number five, requisitions.
So move.
Oh, second.
Discussion. Commissioner Lundy.
Aye.
Commissioner Moore.
Sorry. Aye.
Number six, travel.
So moved.
Second.
Discussion. Commissioner Moore.
Aye.
Commissioner Lundy.
Aye.
Number seven, bills.
So move.
Second.
Discussion. Commissioner Lundy.
Aye.
Commissioner Moore.
Aye.
Under eight, authorize various personnel actions as indicated on the summary sheet for employees of the jurisdiction of Lorraine County Commissioners. At the conclusion of today's board meeting, the Commissioners may recess an executive session to discuss personnel, new hires, and board appointments. Number nine, approve and waive the reading of the minutes of June 15th.
Before we vote on number 9, there was an error, so how do we proceed if I see something that wasn't typed up right? Do
On
we
the
make the
minutes?
motion, or do we do a?
Well, I mean, you'd call the error and then we
Yeah, and then I can.
can amend the minutes.
Okay, sorry. So then I go so moved, and,
Okay,
or did you do that? Okay,
I'll second. Sure.
okay.
then discussion?
Sure.
Okay, let me go on to here. I already signed this, so that's, no, that's mine. Okay. Do I just show it to her, I guess?
Okay.
In regards to, I don't want to write on this because she does such a good job. This is some hard work. She has to type our words in the minutes, which is not easy to do, so congrats. So, on here, you talk about, it says, and allow him to have a discussion. What happened was there was a roll call and not allow him to have a discussion. So if we can put not in
Not?
there, that's the only thing missing.
All right.
Everything else was fine. I just wanted to, I just put a sticky note on there, so if that's appropriate.
Then I'll just
then you
change it.
could- I hate to do that to you because I know it's a, okay.
Let me just, Commissioner Lundy doesn't object to the characterization of the change, correct?
No, I mean,
Go ahead and
you know,
read it if you wanna
I
read
made the determination to
Correct.
call,
I'm
to
not,
call the
not
roll.
the
and-
issue, but that's an accurate representation of what occurred. It was-
Even under Robert's rules, the chair calls for an immediate vote and there's no discussion, so that's an accurate reflection of the
Yeah,
record.
that's what,
I'll just put that in.
Okay, well, not, that's all. Okay, then I'll, there you go.
Commissioner Moore?
Aye.
Commissioner Lundy.
Aye.
Workforce Development, number 10, extend the interagency agreement with Lorraine County Port Authority for work experience payments to participants. This is for the Career Services for the Workforce Innovation and Opportunity Act Adult and Dislocated Worker Programs. WDA will reimburse Port Authority for payments made to TANF Summer Employment Program. CCMEP in traditional jobs participants for wages paid and all other payroll-related expenses, in addition to 5% administrative fee and total amount not to exceed $637,001.85 to be paid from the accounts We Adult Dislocated Youth and CCMEP TANF accounts effective July 1st, 2022 through June 30th, 2023.
So moved.
Second.
Discussion. Commissioner Moore?
Aye.
Commissioner Lundy.
Aye.
11, approve an MOU between Community College Aspire Program to assist WDA in providing academic skills supplement for employment and training services to participants deemed in need by staff by Ohio Means Jobs. Is the provider of adult literacy and basic skill remediation services. WDA will reimburse College Aspire Program when invoiced to cover all costs incurred, not to exceed $40,000, be paid from the We Adult Dislocated Youth account and CCMEP TANF account effective July 1st, 2022 through June 30th, 2023.
So moved.
Second.
Discussion. Commissioner Moore?
Aye.
Commissioner Lundy.
Aye.
Clerk of Courts advertised bids for carpet replacement. Notice being in the Chronicle on June 28th and July 5th. Open at 2 p.m. on July 19th. Mandatory pre-bid meeting will be held at 10 p.m. on July 12th at the project site at 225 Court Street, Elyria.
So moved.
Second.
Discussion. Commissioner Moore?
Aye.
Commissioner Lundy.
Aye.
Engineer, receive and journalize the county's engineer annual report on the condition of ditches under county maintenance for the year 2022. Authorize county auditor to assess for maintenance as recommended by the county engineer for the year 2023, tax lien 2022.
So moved.
Second.
Discussion. Commissioner Moore?
Aye.
Commissioner Lundy.
Aye.
Amend Resolution 21-372 adopted June 2nd, 2021, agreement with Geosci, Inc. in the amount of $100,000 for the Woods at Eaton Subdivision, Eaton Township. Said amendment is to reflect an increase of $10,000 for total agreement of $110,000 to complete testing and be paid from the Engineer Project MVGT account and reimbursed by the subdivider.
So moved.
Second.
Discussion. Commissioner Moore?
Aye.
Commissioner Lundy.
Aye.
Sheriff enter an agreement with Ron O'Brien and his firm Ziegler, Tiggs, and Little to provide Lorraine County Sheriff with legal services related to discussion with Lorraine County Prosecutor.
I'd like to move to table until after executive session so we can talk with the prosecutor some more in regards to this. Is that appropriate?
You can if you choose.
Is that okay?
Sure.
Okay.
So
Move
I
to
guess-
table.
And I'd second that. But just so I understand, table doesn't mean that it comes up at the next meeting. It means
No.
that we could
No.
discuss it in exec
I'm
and bring it
moving
back.
You have questions about it. I mean, I drafted the agreements.
I know, but I
can
don't want
explain
to
it.
talk about it out here.
Yep, that's
Okay.
fine. You can, and then you can bring it up when you come back out.
Okay.
Yeah.
Is that okay?
Sure.
I have a motion and a second. Commissioner Moore?
Aye.
Commissioner Lundy.
Aye.
Under Veterans, amend Resolution 22-394 adopted May 25th, 2022, awarding a contract to Schirmer Construction LLC, North Olmsted, in the amount of $298,000 for the Veterans Service Office Alteration Project. Amendments to reflect an increase in contract due to the unit prices were not included for the HVAC in previous resolution. Total contract is $373,000 and will be paid from the capital improvements account.
So move.
Second.
Discussion.
This is coming right out of our capital improvements. Is this part of their veterans budget?
I believe, Commissioner, that will be reimbursed with
Reimbursed through the-
ARP money
Oh, okay.
for the HVAC. That's why we pulled
Right,
it out. because
exactly.
That was
That's-
eligible and the other stuff wasn't.
Yeah, I
Right.
think we talked about this last
Yeah,
week.
yeah,
So we're
okay.
putting through this just as the ARP eligible portion of the project.
Okay, okay, thanks.
Yeah, just so the public knows that under the Rescue Act dollars, obviously you can make improvements to ventilation systems, and because there was a ventilation component to the work being done over there, it just made sense that that was and it is a proper expenditure.
It is, in the opinion of my office, it is. It's ventilation, it's an
Right.
upgraded filtration system. Ideally, these kinds of systems are set up so that we can work in a healthier environment. I think under those circumstances, it's appropriate expenditure of the ARP dollars.
Commissioner Lundy.
Aye.
Commissioner Moore?
Aye.
Public comment, not seeing anyone has signed up. I think some of the folks who spoke this morning thought they had to fill out the forms, so I'll pass
that what
those
this
on
was?
to you. So they all did their homework,
Unless you want to
right?
speak, you don't want to
No.
speak.
We'll move on to County Administrator J.R. White.
No report today.
No report this morning. The Assistant County Prosecutor, Dan Petticourt.
I again have no report, but there is, if the board decides to go into executive session and discuss personnel, new hires, and the other things mentioned by the clerk, I also have one piece of current litigation and one piece of potential litigation I can update the commissioners on.
Okay, and I'd like to include the potential purchase or sale.
Purchase, sale, of public property, thank you.
Yeah.
I knew I missed one of them.
You gotta keep reminding me.
I need a list, I do.
I know. So, up next, Commissioner's report. Commissioner Moore.
Basically, we are honored that the Ohio Department of Development and the State Historic Preservation Office has selected downtown Elyria as its host location to announce statewide award winners for round 28 of the Ohio Historic Tax Credit Program. Basically, these awards are being announced while we were having our meeting. It was downtown at the Foundry, and they're very optimistic about Forge 417. That's the planned historic renovation of the Dixon and Robinson buildings in downtown Elyria. This is a huge project. It's really going to change downtown Elyria, and it was nice to meet a lot of people from the state that came up for this huge announcement, and they were downtown Elyria this morning at 10 o'clock. Our meeting started at 10:30, so I couldn't participate, but I got to meet a lot of them before we started. So congratulations, downtown Elyria. That was it. That's it for my report.
Okay.
So I couldn't go where you were at.
Yeah, first, I guess I just want to point out that there's an issue that has surfaced in the community that has caused me concern. And so I have reached out to the company involved and also to state leaders in Columbus. This is involving the old NRG facility in Avon Lake. I have sent letters to the vice president of Shara Solutions. That is the company that is now has taken possession of the property and is working on the, I guess you could say, the demolition and the abatement of that property. It's important for the public, and I've also sent a similar letter to the governor and to the secretary, or the lieutenant governor as well. Here's the concern. The concern is that when Shara came in and acquired the NRG property, the old facility, they told city leaders very clearly that 75% of the workforce that would be used for this project would be local labor. And to date, the company has not honored that commitment. So the other thing that the company had indicated was that they would hold public meetings to talk to the public, to see what their interest was, what their desires were for the development of that site. And they have not honored that commitment either. So the letter that I sent to them expressed my concern. Of course, starting with, I'm always willing to work with you. However, there are concerns needing to be addressed as you demolish and develop the old NRG energy facility in Avon Lake. Went on to write, your company made a commitment to the citizens of Avon Lake when you told city leaders that 75% of the work would be conducted by local labor. Your company also told city leaders that community listening sessions would be held to identify how the residents would like to see the site developed. I have already reminded representatives of the company of these commitments during recent meetings that I had at the plant, and to date, your company has not honored these commitments to the residents and the leaders of Avon Lake. To build trust in a credible working relationship, it's important that you honor the commitments you've made. We are proud of our work ethic in Lorain County and here in Ohio. We have skilled and qualified Ohioans who can do the work that is now being done by out-of-state workers. I take seriously my responsibility to protect Lorain County and Ohio jobs and ask that you immediately reverse course and have local labor, as you told city leaders you would do, perform the work needed at the old power plant. Went on to write, to build trust and credible working relationship, it's also important that you honor your commitment to hold community feedback sessions. I take seriously my responsibility to make sure the voices of our residents are heard. They've lived with this facility in the community. They want to make sure that this critical lakefront development fits well with their vision for the future of Avon Lake. And I'm calling on you to do the right thing. I stand ready to work with you, but you must honor your commitments to the city of Avon Lake. Local labor can do the job, and the voices of the residents must be heard. I'd sent that to Scott Reisley. I've now arranged to have a meeting with him. I understand he's going to be in the community, I think, next week. We may have the opportunity to actually have a discussion about this whole thing. Also sent a similar letter off to the Lieutenant Governor and to Governor DeWine, asking that the state take a look at the issue as well, too, because, you know, this Board of Commissioners provided support to the city for the city to receive a $300,000 grant for the remediation of that site. And, you know, I think, quite frankly, as state leaders, too, if we have workers in this state who can do the job, it doesn't make sense that out-of-state workers are coming in and doing the work. So I just felt it was important to send these letters to make sure the company holds its commitment to the community and to the leaders there, and look forward to meeting with the Vice President of SHARA. And my office is in the process of arranging that. They have responded, and it looks like we'll be able to finally meet next week to discuss it more. Other matters, like to send sympathies out to Carol Billman and the family of Dan Billman. Dan is our former solid waste director here in the county. Dan was always very involved in the community, always had a smile on his face. A lot of people know Dan from his old days of his towing company here in Elyria and other projects that he was involved with. And just a good man with a good heart and always willing to help out. And I think even to the very end, when it was really difficult for him to get around, you'd still see him pulling up to events, getting out of his car and making every effort to be there. But just a good person, so quite a loss for the community. We send our sympathies out to his wife, Carol. The Kiwanis Strawberry Festival was held at St. Mary's. They hadn't held the event in 2 years. It was good to see folks there. It's a major dose of sugar and calories, but it was really good, and I can't say enough good things about what Kiwanis does for our communities. Leadership Lorain County had asked me to speak about careers in government, along with some other individuals that work in government, and that was held over actually at the community room at the Elyria Police Station. I really enjoyed that opportunity speaking to college students. It was interesting when I first walked in and I looked and I thought they were high school students, but I guess it shows the aging factor here. They're actually college students, and we had a really good discussion. The first ever Juneteenth event was held on the square in downtown Elyria on Saturday. Good turnout for that. That followed an earlier trip I had in the morning to the Duct Tape Parade and the Duct Tape Festival, which was held at Mercy Stadium in Avon. Nice turnout there, and I think I posted a picture online. They had a bunch of rubber ducks that they were selling, and they had all kinds of different, professionals, whatever. There's one that looked like a police officer, one that looked like a judge, and all kinds of different occupations. But I just never thought I'd be looking at a table trying to find something that looked like me. But it was like $2 helping out some animal protection groups. So it was neat, but a good event. The Blues Fest was really nice. They did a, is that called a dance line, where everybody walks in, like when they're walking through the streets of New Orleans. But they held one of those and marched into the Lakefront View Beach Park, and great music, good turnout there. And they also had a business expo held at Johnny Wilson Park. For business vendors, a lot of good events for kids, and boy, that park was packed that day, just packed. And as we all know, that was actually a delightful day. Folks were even sitting in the sun because it was so nice and cool and comfortable. The Mercy ribbon cutting, Mercy Hospital ribbon cutting for their facility there in Sheffield Village. I was not able to make that event, but can't say enough good things about our healthcare community in the county and in this region. Really blessed to have probably the strongest healthcare facilities and doctors and nurses and everyone else that you're going to find put our folks up against anybody in the country, probably in the world too. And the international breakfast this morning, always nice to walk in, be greeted by all the international princesses. And so it's officially underway. It's good that everything's back, and just so many people are saying it's just so great to be around folks again and be out celebrating the international in the international city. So hopefully you'll come out and attend that this weekend at Black River. And that completes my report. Madam Clerk, clerk's report.
I have nothing.
You have nothing.
Board correspondence?
Board correspondence. Even though Dave wants it read, I'm going to make the motion that you not read the board correspondence this week.
Just looking at Dan.
So,
Yeah, I'll second that.
Further discussion. Commissioner Lundy,
Aye.
Commissioner Moore.
Aye.
Okay, at this,
To the 30s right now anyway, so I don't know.
Oh, really? Oh, okay.
jeez. Well, at this time, I'm just going to move that we go into executive session for the reasons outlined by the Assistant County Prosecutor.
Second.
Discussion. Commissioner Lundy,
Aye.
Commissioner Moore.
Aye.
And we have returned from executive session. At this time, I'm going to make a motion to untable item number 15.
I'll second.
Discussion.
Do you want to read it again since we've come back?
Well, I'll do this and then I'll read it.
Okay.
I think you can vote on that. Commissioner Lundy,
Aye.
Commissioner Moore.
Aye.
So on table number 15, on the sheriff enter into agreement with Ron O'Brien and his firm Ziegler, Tiggs and Little to provide Lorraine County Sheriff with legal services related to discussion with Lorraine County Prosecutor.
So moved.
Second.
Discussion. Commissioner Moore.
Aye.
Commissioner Lundy.
Aye. At this time, I'll bring up the personnel summary sheet with a motion to approve.
I'll second.
Discussion. Commissioner Lundy.
Aye.
Commissioner Moore.
Aye.
Any other business come before the board? Seeing none, this meeting is